So Cameron, great to be in the downtown space and see the concept in reality, giving people a sense of community.
Yeah, we were really trying to develop a community feel to this space. It's almost like a town square. So we've organized around it stores, the cafeteria, all of those kind of public aspects that people access into. Additionally, we've brought a lot of natural light in here. We've got one of the light wells is here, and you can actually see right through the building into the outside. So just giving it that kind of community, city kind of feeling to it.
And of course there's the library, patient and staff. The clothing shop that our volunteers will run is a wonderful place for people to access clothing at no cost. The patient council is where people will come to be with their co-patients and also talk about things that they need to talk to us about making it as patient-friendly a building as possible. Family council is also here and make sure it's family-friendly as well as patient-friendly.
Yeah, we have a store over here that you'll be able to buy chips and gifts, and adjacent to it is the Outlook Cafe, which is really the cafeteria for the building. It's a little cafe where you can go in and grab something to eat, and it's got a great view to the outdoors here and light coming in from the courtyard in behind us. And then down at the end of the corridor here is the chapel and meditation space. And across from it, there's a large auditorium that you can use for some of the research or education.
Education's a big part of our role in many regards, certainly to share some research findings that we may have discovered recently, but also many of our staff and physicians have expertise that we share with others, and of course we bring in others from other communities as well to help educate us. You've probably already noticed the retail pharmacy that we have back behind us, so they can fill prescriptions for anybody, in addition, obviously for our patients, just like they would any pharmacy in the community.
There's also a large gym, so people can play basketball or floor hockey or whatever in there, and adjacent to it is an exercise room with fitness equipment, and so there are great views into those two spaces. One of the things that I always try and do in buildings is introduce sitting areas and benches. This space really becomes sort of an integration area where there may be inpatients in here as well as public that are coming in from the outside. So it has kind of that feeling of being able to have the mixing of those different groups without anyone really knowing whether you're an inpatient or outpatient. One of the things that we were really trying to do is kind of break down those barriers and allow that interaction to happen within the building here.
In a very natural way.
Right.
It's perfect. Yeah. So here we are in the Chapel of Hope, and with St. Joseph's as a faith-based organization, this is one feature that we needed to have. So.
Yeah, and we worked very hard on creating a beautiful, contemplative, worshipful, meditative type space here by introducing the channel glass along the wall here that has the light kind of transfused into this space. We're trying to give it that kind of special quality and character. And sort of trying to introduce it, we've got a window that points out here and the ability to see out into the chapel garden over here as well. We're really trying to kind of create a very, very special space here that you could use either as a meditation space or a chapel for more formal kinds of events.
I think it'll appeal to many people's spiritual needs. And we also have a labyrinth here inside and outside.
Absolutely. It's interesting, during the design of the building, I went to Chartres Cathedral in France where this was a classic example of a labyrinth, and so I sent photographs back to people in the office saying, you know, this is what we're trying to create here. We were trying to kind of give that spiritual angle that a labyrinth provides. And so we've got a doorway access to the outside chapel garden here as well, so it gives you the opportunity on a nice day to extend that service out into the chapel garden. We are in what we've called the knuckle, and it really is kind of an important part of the whole design because it creates that transition zone between the house unit, which is over here, the neighborhood, and the downtown, which is behind us. And it's not only a physical transition, but it also is a kind of conceptual transition as patients are moving from that house area to the neighborhood and to the downtown, which kind of represents the community. We've also introduced, as you can see behind me, the courtyards, bringing natural light into this space because we really felt it was important to provide that natural light at this kind of key point in the building. And also it helps to orient yourself again in a large building that you know when you get to the knuckle area, you can kind of see outside and kind of get an idea of where you are in the building.
It allows us to have a unit clerk here as a bit of a reception, welcoming in just before we enter the house.
So can you direct us to the neighborhood and we'll look there?
Absolutely, right down here.